Hi everyone, this is a detailed video of mine about Raynaud's disease. Well, it causes some areas of your body such as your fingers and toes to feel numb and cold in response to cold temperatures or stress. In Raynaud's disease, smaller arteries that supply blood to your skin become narrow, limiting blood flow to the affected areas. This is known as vasospasm. Women are more likely than men to have Raynaud's disease, also known as Raynaud's or Raynaud's phenomena or syndrome. It appears to be more common in people who live in colder climates. Treatment of Raynaud's disease depends on its severity and whether you have other health conditions. For most people, Raynaud's disease is not disabling, but it can affect your quality of life. Now, let me tell you the symptoms. Signs and symptoms of Raynaud's disease include cold fingers or toes, color changes in your skin in response to cold or stress, numb, prickly feeling or stinging pain upon warming or stress relief. During an attack of Raynaud's, affected areas of your skin usually first turn white, then they often turn blue and feel cold and numb. As you warm and your circulation improves, the affected areas may turn red, throb, tingle or swell. Although Raynaud's disease most commonly affects your fingers and toes, it can also affect other areas of your body such as your nose, lips, ears, and even nipples. After you warm up, the return of normal blood flow to the area can take 15 minutes. You should see your doctor right away if you have a history of severe Raynaud's and develop a sore or infection in one of your affected fingers or toes. Now let me tell you the causes. Doctors do not completely understand the cause of Raynaud's attack, but blood vessels in the hands and feet appear to overreact to colder temperatures or stress. With Raynaud's disease, arteries to your fingers and toes become narrow and briefly limit blood supply when exposed to cold or stress. Over time, these small arteries can thicken slightly, further limiting blood flow. Cold temperatures are most likely to trigger an attack. Exposure to cold, such as putting your hands in cold water, taking something from a freezer, or being in cold air is the most likely trigger. For some people, emotional stress can trigger an episode. Now I will tell you the difference between primary versus secondary Raynaud's disease. Well, there are two main types of the condition. Primary Raynaud's, also called Raynaud's disease. This is most common form, is not the result of an associated medical condition. It can be so mild that many people with primary Raynaud's don't seek treatment, and it can resolve on its own. And now I'll tell you about secondary Raynaud's, also called Raynaud's phenomena. This form is caused by an underlying problem. Although secondary Raynaud's is less common than the primary form, it tends to be more serious. Signs and symptoms of secondary Raynaud's usually appear around age 40, later than they do for primary Raynaud's. Now I will tell you the causes of secondary Raynaud's disease. The first is connective tissue diseases. Most people who have a rare disease that leads to hardening and scarring of the skin, scleroderma, have Raynaud's. Other diseases that increase the risk of Raynaud's include lupus, rheumatoid arthritis, and Sjogren's syndrome. Disease of the arteries. These include a buildup of plaques in blood vessels that feed the heart, a disorder in which the blood vessels of the hands and feet become inflamed, and a type of high blood pressure that affects the arteries of the lungs. Carpal tunnel syndrome. This condition involves pressure on a major nerve to your hand, producing numbness and pain in the hand that can make the hand more susceptible to cold temperatures. Then another cause could be a repetitive action or vibration. Typing, playing piano, or doing similar movements for long periods and operating vibrating tools such as jackhammers can lead to overuse injuries. Smoking. Smoking constricts blood vessels and that can lead to this illness. Injuries to the hands or feet. Examples include a wrist fracture, surgery, or frostbite. Certain medications. These include beta blockers for high blood pressure, migraine medication that contain ergotamine and sumatriptan, attention deficit hyperactivity disorder medication certain chemotherapy agents, and drugs that cause blood vessels to narrow, such as some over-the-counter cold medications. Now I'll tell you the risk factor. Risk factors for primary Raynaud's include sex. More women than men are affected. Age. Although anyone can develop the condition, primary Raynaud's often begins between the ages of 15 and 30. Climate. The disorder is also more common in people who live in colder climates. Family history. A first-degree relative, a parent, sibling, or child having the disease appears to increase your risk of primary Raynaud's. Risk factors for secondary Raynaud's disease include associated disease. These include conditions such as scleroderma and lupus. Certain occupations. These include jobs that cause repetitive trauma, such as operating tools that vibrate. Exposure to certain substances. This includes substances taking medication that affect the blood vessels and being exposed to certain chemicals such as vinyl chloride. Now I'll tell you the complications. If secondary Raynaud's disease is severe, which is rare, reduced blood flow to your fingers or toes could cause tissue damage. A completely blocked artery can lead to sores, skin ulcers or dead tissue, both of which can be difficult to treat. Rarely extreme untreated cases might require removing the affected part of your body. Now I'll tell you some preventive measures. To help prevent Raynaud's attack, bundle up outdoors. When it is cold, don a hat, scarf, socks and boots, and 2 layers of mittens or gloves before you go outside. Wear a coat with snug cuffs to go around your mittens or gloves to prevent cold air from reaching your hands. Also use chemical hand warmers. Wear earmuffs and a face mask if the tip of your nose and your earlobes are sensitive to cold. Warm your car. Run your car heater for a few minutes before driving in cold weather. Take precautions indoors. Wear socks when taking food out of the refrigerator or freezer. Wear gloves, mittens or oven mitts. Some people find it helpful to wear mittens and socks to bed during winter because air conditioning can trigger attacks. Set your air conditioner to a warmer temperature. Use insulated drinking glasses. Okay, now I will tell you about the diagnosis. Well, when patients come to us, we ask for the symptoms and medical history and perform a physical examination. And then we might also order tests to rule out other medical problems that can cause similar signs and symptoms. Now, then we will differentiate between the primary versus secondary Raynaud's. To tell the difference between primary and secondary Raynaud's, we might do a test called nail fold capillaroscopy. During the test, the doctor looks at the skin at the base of your fingernail under a microscope or magnifier to look for deformities or swelling of the tiny blood vessels. If your doctor thinks that another condition such as an autoimmune disorder or a connective tissue disease may be causing Raynaud's, he or she will likely order blood tests such as anti-nuclear antibody tests. Testing positive for these antibodies might be a sign of stimulated immune system, common in people who have connective tissue diseases or other autoimmune disorders. Erythrocyte segmentation rate. This test determines the rate at which red blood cells settle to the bottom of a tube. A faster than normal rate might signal an underlying inflammatory or autoimmune disease. No one blood test can diagnose Raynaud's. Your doctor might order other tests such as those that rule out diseases of the arteries to help pinpoint a condition that can be associated with Raynaud's. Now I will tell you the treatment. Well, dressing for the cold in layers and wearing gloves or heavy socks usually are effective in dealing with mild symptoms of Raynaud's. Medications are available to treat more severe form of the condition. The goals of treatment are to reduce the number and severity of attacks, prevent tissue damage, treat the underlying condition or disease. Now I'll tell you some about medications. Depending on the cause of your symptoms, medication might help to widen blood vessels and increase blood flow. Your doctor might prescribe calcium channel blockers. These drugs relax and open small blood vessels in your hands and feet, reducing the severity and number of attacks in most people with Raynaud's. These drugs can also help heal skin ulcers on your fingers or toes. Examples include nifedipine that comes with the name of Adalat. Then another drug is amlodipine that comes with the name of Norvasc. and also you can take phalodipine and isradipine. Vasodilator. These drugs which relax blood vessels include nitroglycerin cream applied to the base of your finger to help heal skin ulcer. Other vasodilators include the high blood pressure drug losartan. Then we can also use the erectile dysfunction medication sildenafil that comes with the name of Viagra, the antidepressant fluoxetine that comes with the name of Prozac, and a class of medication called prostaglandins. Surgery and medical procedure. If you have severe Raynaud's, your doctor may recommend surgery or injection. Nerve surgery. Sympathetic nerves in your hands and feet control the opening and narrowing of blood vessels in your skin. Cutting these nerves interrupts their exaggerated responses. Through small incisions in the affected hands or feet, a doctor strips these tiny nerves around the blood vessels. This surgery, if successful, might lead to fewer and shorter attacks. Then also we can use chemical injection. Well, doctors can inject chemicals such as local anesthetic or botulinum toxin A, that is Botox, to block sympathetic nerves in infected hands or feet. You might need to have the procedure repeated if symptoms return or persist. Now I'll tell you some lifestyle and home remedies. Well, there are a variety of steps you can take to decrease Raynaud's attack and help you feel better. First of all is avoid smoking. Smoking or inhaled secondhand smoke causes skin temperature to drop by tightening blood vessels, which can lead to an attack. Exercise. Exercise can increase circulation among other health benefits. If you have secondary Raynaud's, you should talk to your doctor before exercising outdoors in the cold. Control stress. Learning to recognize and avoid stressful situations might help control the number of attacks. Avoid rapidly changing temperature. Try not to move from a hot environment to an air-conditioned room. If possible, avoid frozen food sections of grocery stores. And I'll tell you what to do during an attack. Warm your hands, feet, or other affected area to gently warm your fingers and toes. Get indoors or to a warmer area. Wiggle your fingers and toes. Place hands under armpits. Make wide circles with your arm. Run warm, not hot. You can run warm water, not hot water, over your fingers and toes. Massage your hands and feet. If stress triggers an attack, get out of the stressful situation and relax. Practice a stress relieving technique that works for you and warm your hands or feet in water to help lessen the attack. And then I can tell you something about alternative medicine. Well, lifestyle changes and supplements that encourage better flow might help manage Raynaud's. However, it is unclear how well these measures may work for Raynaud's. More study is needed for this. If you are interested, you should talk to your doctor about fish oil. Taking fish oil supplement could help improve your tolerance to cold. Ginkgo supplement could help decrease the number of Raynaud's attacks. Acupuncture, this practice appears to improve blood flow, so it may be helpful in relieving Raynaud's attack. Biofeedback. Using your mind to control body temperature might help decrease the severity and number of attacks you experience. Biofeedback includes guided imagery to increase the temperature of hands and feet, deep breathing, and other relaxation exercises. Your doctor might be able to suggest a therapist who can help you learn biofeed techniques. Okay, so this was my video about Raynaud's disease. I hope you like this video. If you have any question about this, you can post in the comment section. Thank you very much for watching this video. See you in the next video. Bye for now.